Hello, everyone. My name is Ufoma Uibororo, and here at the School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Addressing Challenges for Youth Experiencing Homelessness During COVID-19. The School-Based Health Alliance and National Healthcare for the Homeless Council have invited Schoolhouse Connection to share their knowledge and facilitate discussions on promising practices for addressing and supporting youth through these challenging times. In this webinar, we will explore these challenges and provide discussions on topics including considerations for youth experiencing homelessness during the pandemic and racial justice movement, connectivity to healthcare, and school reentry and access. Before we begin, if you are viewing as a group, please go to the chat window in the chat icon and type in the name of the person registered for this webinar and the total number of additional people in the room. This will help us with our final attendance count. The School-Based Health Alliance is the national school-based healthcare advocacy, technical assistance, and training organization based in Washington, D.C. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based healthcare. As youth-friendly and accessible settings, school-based health centers are uniquely positioned to deliver high-quality, confidential services that equip children and adolescents with the information, tools, and support they need to be healthy and safe where they are when they need it in school. We believe that all children and adolescents deserve to thrive. When health and education come together, great things happen. The National Healthcare for the Homeless Council is a 501c3 nonprofit corporation established in 1986 with its main office located in Nashville, Tennessee. The National Healthcare for the Homeless Council is a premier national organization working at the nexus of homelessness and healthcare. Grounded in human rights and social justice, the NHCHC mission is to build an equitable, high-quality healthcare system through training, research, and advocacy in the movement to end homelessness. Now we have a few housekeeping reminders. All attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during this webinar, please use the chat tool located in your Zoom control bar. We will address questions following the presentation. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 1 to 3 business days. Please also visit the School-Based Health Alliance website for additional archived webinars for topics such as the ones you are viewing on your screen. Now, I would like to introduce our presenters for today. We will be hearing from Ashley, a Schoolhouse Connection scholar, Patricia Julianelle, a senior strategist for program advancement and legal affairs at Schoolhouse Connection, and Jillian Sitar, a program manager for higher education at Schoolhouse Connection. Jillian?
All right, thank you. I think we're gonna be switching screens, so I'll just get a second for my colleague to get her screen up. Perfect. So, hi everyone. Again, my name is Jillian. Today we're gonna provide some context about youth homelessness. I'm so excited that we'll hear from Ashley directly to hear that youth perspective. And then we're gonna talk through the different challenges and opportunities with telehealth, school reentry, access to services, both in K-12 and in higher ed. Our learning objectives today are here on the screen, but they include understanding the extent of student homelessness and associated health risks, understanding the challenges that these students are facing while accessing healthcare, especially in light of COVID, and then lastly, understanding the many challenges that these students will face returning to school in the fall, whether it's going in person or in remote or a hybrid between the two. And while we're going to be sharing all the examples and strategies that we know, we hope to learn from you as well. So there will be points in time throughout this presentation where we ask for you to engage with us in the chat box portion. But before we get started, I wanted to talk about who we are. So here at Schoolhouse Connection, we are a national nonprofit working to overcome homelessness through education. We provide strategic advocacy on the federal and state level and provide practical assistance like this webinar here today in partnership with many people working with youth themselves directly. So that's including schools, early childhood programs, higher ed institutions, service providers, families, and of course, youth themselves. We have more information on our website on the slide here, and we have an amazing Q&A from our inbox. I highly suggest that you all subscribe to our newsletter so you can get all of this information directly to your mailbox. And with that, I'm going to turn it over to Patricia to do a quick poll.
Thank you, everyone. I'm sorry I had some trouble getting off mute there. Thank you for helping me out, fellow panelists. We want to do a poll with you. We'd like to find out a little bit about who we have on the webinar with us today. So we'd like to know how much experience you have working with youth experiencing homelessness in your program or in your school or school district. So I think you should be able to go ahead and click on one of these poll answers now, and then we'll be able to see what kind of a response we get. Okay, so this is a pretty good mix of participants. First of all, thank you for participating in the poll. It's nice to make things a little bit interactive, even though we're on Zoom. And it's nice to see that we have a really good mix of people who have a lot of experience with this population to those who have fairly little. I think that'll make for a rich discussion when we stop throughout the presentation, as Jillian mentioned, to get some input from you all and to learn from your best practices and from your experiences. So thank you very much for participating in that poll, and appreciate it. We're going to go forward now into our presentation. We're going to share some information with you and then hopefully get some information back from you and share together. So just a little bit of context. Some of you may be very familiar with the McKinney-Vento Act. Some of you may never have heard of it. So to let you know, the McKinney-Vento Act is a federal law that provides education rights and services for students experiencing homelessness. So as it is a federal law, it does apply to all local educational agencies. So that includes school districts and county offices of education, public schools, as well as public charter schools. And it requires every one of those local educational agencies to designate a homeless liaison who is just a staff member at that LEA who's in charge of understanding the McKinney-Vento Act and implementing it in that LEA, identifying their students experiencing homelessness and making sure that those students receive services in school, but also referrals for services out of school to include healthcare services, dental care, and mental health care services as well. So if you'd like a little bit more information on McKinney-Vento, there's a 2-page overview on our website. You can click on that link and get some more information. And we also have, plenty of information about McKinney-Vento on our website.
Great. And so when we're talking about homelessness, we're using the Department of Education definition, which is more broader. And so that definition is meaning that a child and youth who lack a fixed, regular, and adequate nighttime residence. And so again, this definition is broader than the definition of homelessness used by HUD. And so we have on this slide here a few examples of what entails a fixed, regular, and adequate nighttime residence. And so for the first bullet point, we see sharing the housing of others due to loss of housing economic hardship or similar reason, or also known as couch surfing, and that we see about 75% of identified McKinney-Vento students in 2017 to 2018 were couch surfing and fit that bullet point. And so you can see some of the other examples listed on this slide here, but I do want to note at the bottom that for college students who are living in the dorms or residence halls during the school year, but otherwise would have nowhere else to go, they would also meet this definition. There's also a further distinction for unaccompanied homeless youth. And so that is youth under the age of 24 who meet the definition of lacking a fixed, regular, and adequate nighttime residence, but are also not in the physical custody of a parent or guardian. And just as Patricia was talking about the McKinney-Vento Act, there are really distinct laws and policies for unaccompanied homeless youth, and they are such a particular vulnerable population. And so now that we've kind of given you these common definitions and denominators, I'm going to turn it over to Patricia to do a deeper dive and talk about the prevalence of youth homelessness.
Thanks, Jillian. Knowing that we would have a lot of healthcare professionals on the call today, as well as education professionals, we wanted to share some data from the Youth Risk Behavior Survey. If you're not familiar with the Youth Risk Behavior Survey, it's sponsored by the Centers for Disease Control and administered by states, primarily state departments of education, but often state departments of health. And it's a survey that is administered to high school and sometimes middle school students around the country to ask them questions about basic demographic issues, as well as different health risk factors. Back in 2017, a number of states included questions about homelessness on their YRBS. That question actually will now be on the standard questionnaire for 2021, so we'll be able to get even more data. But just based on the data that we have gotten from about 17 states in their 2017 YRBS surveys, we were able to find that about 4.9% of high school students reported that they had experienced homelessness just in the last 30 days. So if we extrapolate that over the course of the school year, we can imagine that percentage would be much higher. But if you look at just over the last 30 days, for every just under 18 students, one student had experienced homelessness. So you could even think about, one or more than one student in every classroom across the country experiencing homelessness just in a 30-day period. In terms of some of the demographics, it's really important to note the disparities along lines of race, ethnicity, as well as sexual orientation. So based on the YRBS data, we were able to determine that Black students were 2.67 times more likely to experience homelessness than white students. Hispanic or Latino students, 1.68 times more likely to experience homelessness than white students. And then when we look at sexual orientation, we found that LGBTQ students were almost 3 times more likely than heterosexual students to experience homelessness. And you may be noting that I said LGBTQ and I did not include transgender students in that. That's simply because the YRBS data wasn't sufficient for us to make a conclusion regarding transgender students, but we know from other sources of research that transgender students and young people absolutely are significantly overrepresented among youth experiencing homelessness. Jillian?
Great. And so unfortunately, we don't have as much support structures in higher ed as there is in high school and K through 12 for students experiencing homelessness. But this has become such a popular issue within the last few years, and it's really been, highlighted because of the pandemic. And so this survey was conducted by the Hope Center and released early this year. And in 2019, so prior to COVID, This survey had over 167,000 students from 171 two-year institutions and 56 four-year institutions responding to the Real College survey. We can see that 17% of students at two-year institutions and 16% of students at four-year institutions reported being homeless within the last year. And so we actually imagine that these numbers are much higher because, while there are many students, we know that the typical students who are filling out these surveys are the ones that have the time, capacity, technology to do so. And so on this slide, we see the data being broken down by demographics and race, and we can see that people of color, specifically Indigenous, American Indian, and Black communities, have much higher rates of homelessness in comparison to their peers. And then again, this data is broken down by gender, identity, and sexual orientation. And pretty similar to what Patricia had shared, we see that members of the LGBTQ+ community have higher rates of homelessness in comparison to their peers as well. And we know that these identities often intersect at times and they can be compounding. So an LGBTQ student of color would have even higher rates of homelessness. The Hope Center was actually able to conduct a study about student homelessness from mid-April to mid-May during the peak part of the pandemic, or part of the ending of the peak of the pandemic. They surveyed over 38,000 students from 54 colleges and universities. And although the percentages, being 15 at 4-year and 11% at 2-year, are lower than the national percentages that I just presented on, we know that this is a smaller sample size, and we also know that, again, during this time, many students experiencing homelessness did not have access to internet, they did not have a laptop, and therefore they weren't able to participate in the survey.
Thanks, Jillian. Whether we're talking about the college level, K-12 level, or certainly younger children, infants, toddlers, and preschoolers experiencing homelessness, we know that homelessness creates additional health risks above and beyond poverty, and even above and beyond what we're seeing with COVID-19 right now. So with the pandemic, the health risks that already were in place for students experiencing homelessness have just been increased, and it's made it even harder for our youth experiencing homelessness to be able to access healthcare and mental health care. We wanted to give you just a quick snapshot of some of what we found from our YRBS data analysis around the risk factors and the health risks associated with homelessness, just to help, again, the attendees understand some of the health issues that are in place for youth experiencing homelessness at all times, and when we think about it in the context of COVID-19 and how these might be exacerbated. So we know from YRBS data that youth experiencing homelessness are more likely to attempt suicide, almost 7.2 times more likely to make a suicide attempt. So more than 1 in 3 of students who are experiencing homelessness reported that they had attempted suicide just over the past 12 months, which is obviously a very shocking and horrible statistic. We also know that substance abuse sometimes can be an issue. The likelihood to misuse prescription pain medication was about 4.63 times more for students experiencing homelessness versus those not experiencing homelessness. So over 40% of students reported that they had misused prescription pain medication. Binge drinking was also disproportionate, 2.41 times more likely to engage in drinking at least 1 day per month, but drinking a large quantity, at least that 1 day. So engaging in binge drinking. We also found disproportionalities in dating violence, both physical dating violence and sexual dating violence. So students experiencing homelessness were 5.88 times more likely to report physical dating violence in their relationships. And they also reported significantly higher levels of sexual violence. So here we have 5.59 times more likely to report sexual assault than students who are not experiencing homelessness. And of course, the YRBS doesn't allow us to extrapolate any reasons for any of this. I think those of us who have experience working with youth experiencing homelessness can think about what a lot of these reasons might be. But what we'd like to do, rather than make any kind of hypotheses, is we'd actually like to hear from a young woman that I'm very proud and very happy to know and to work with. She is one of our Schoolhouse Connection scholars. She is an academically advanced and very hardworking and very bright young woman who we're very fortunate to have as part of our Schoolhouse Connection family. So I'd like to welcome Ash into the conversation, and I'm going to ask Ash some questions and give her the opportunity to speak directly with you about what she'd like to share about some of her own experiences that she's had. And Ash, before we get started, I wonder if you just want to say anything about yourself, anything about what you like to do with your spare time, what you're up to this summer, what you're looking forward to in the fall, just anything you'd like to share with the group to just kind of introduce yourself.
Thank you so much, Patricia, and I truly appreciate your kind words. Hi, my name is Ash. I am a 2020 scholar for Schoolhouse Connections. I just graduated this May, and I will be attending Rensselaer Polytechnic Institute in New York to study industrial engineering and management. And so I'm really excited for that. And in my high school time before COVID, I really liked working with young individuals in STEM. So I worked at my local science center and I taught at the makerspace, and I taught junior high students how to change their society through the makerspace. And then I also worked at a Title I school nearby to teach them STEM curriculum to encourage minorities to follow this underrepresented field of study. And so that's what I really like to do. And so, yeah.
Thank you, Ash. That's a pretty fancy school you're going to. We're really proud of you, and of course, really proud of all the work that you've done already over the past several years. And very, very grateful to you to being with us, for being with us today and sharing some of your insight with us. So let me just dive right into the questions here. So as you think back over the past few months and even now as you prepare to transition to college, can you talk to us a little bit about how COVID-19 has affected you, just practically speaking, your logistics, your living situation, your school, your work? What have some of the big challenges been for you around COVID-19?
Yeah, so everything about my normal daily life kind of changed after COVID. So I had a really tough time transitioning from in-person classes to virtual world, or my internships being completely canceled. And my daily life consisted of taking the bus daily or spending hours doing homework at a coffee shop, and always being around new people. And because of COVID and the new world that we live in, it's completely different. And I am in quarantine for most of the time. A lot of my internships are online. I haven't been on a bus in more than 2 months. So it's completely different than the world that I lived in 3 months prior. And some of my biggest challenges was I'm a graduate from 2020, and I have a twin brother who lives across the states, and it's one of our mother's dreams to see us both graduate. And I couldn't see him graduate because of the health standards of the city and the state that I lived in. And so that was really difficult for my mental health and for my family, really.
Yeah, I bet that must have been really hard, something that you've been looking forward to and, probably really proud of for a long time, and then not to be able to celebrate that or even participate in that the way you wanted to. I think that we're all going through a lot of different kinds of emotional challenges because of COVID-19. And I wonder, are there any other issues that you think that COVID-19 has really affected you emotionally?
Definitely. I think, this title of being an unaccompanied homeless youth, it wasn't something that I chose, but it kind of happened after a series of difficult events. And now during COVID, I have nothing to distract myself from facing these events that I've been trying so hard to keep hidden or to distract myself with a busy schedule. And so there's a lot of emotional vulnerability that I have to open up to, that really faces myself to like what happened in my past, who am I now, and who do I want to be in my future, while being kind of stuck at home, or kind of trying my best to keep up with everything while trying to emotionally be there for myself.
Those are really big and really heavy duty questions that you just posed, about yourself and who you are and who you want to be, and trying to address those alone. You had mentioned prior to COVID, you were used to seeing a lot of people and even just being on the bus and meeting new people. And now you're more isolated, and also at the same time trying to deal with a lot of these big emotional questions. And so I'm wondering, have you been able to, or have you tried to access any kind of mental health care or support or any health care since COVID-19 started? And if you tried to access any of that support, what was that like for you? What was your experience?
I've had a hard time finding resources because I don't have a lot of the requirements that I need. And I just turned 18 not too long ago, so that was a really big stepping stone in order to get these accesses, because I was an accompanied homeless youth. And mental health and physical health were kind of really hard to get without a insurance card, or without parental access. And so with COVID, I haven't been able to get a lot of the things that I need for college or for myself, just to take care of myself, due to that. And so those are some of the barriers I still face today with that. And I'm working really hard in order to get this all situated. And so, yeah.
So it sounds like some of what you're talking about is like documents and logistical stuff like that you're having trouble accessing. And so can you talk a little bit more about kind of what is preventing you from accessing those documents or those logistical things that you need? What's getting in your way and making that hard for you?
A lot of the places that I am trying to get my information from, it's so backed up with emailing, and it's so hard to contact individuals speaking for my behalf as it would be prior to just walking in. And it kind of is upsetting because I only turned 18 right when COVID started. And so it was like a difficulty after a difficulty of trying to get something that is so basic, like an insurance card, or like my, I don't know, any access to glasses or dental care or mental health care. And so,
Yeah, it's a lot. It's like barrier on top of barrier on top of barrier. I'm curious, have you actually been successful in accessing any kind of, like you said, glasses and dental care with all these barriers in place? Have you been able to get any of that kind of support you need, or not yet?
I have been unable to. I've got my glasses online through um, a third party, but I have not been able to go in person since COVID started. And so, I still don't have mental care. I haven't gotten a physical dental care. There's a lot of things that I've been putting off because of COVID and the safety of my those that I live with. And so that's another thing that I have to take in consideration of my actions when going outside of the house and how they affect my inside.
Right, right. And I'll bet you probably need a lot of those things, or college at least is asking you to produce a lot of those things, like the physical or whatever. And so that probably adds to the stress too, I would imagine. Is that right?
Definitely.
Yeah. So tell me, and actually you and I haven't even talked about the specific question, so I don't even know the answer, but have you had any challenges in accessing kind of the basic COVID-19 safety stuff? So, you know, if you want to go out and you need to wear a mask, or, you know, you need to be social distancing. You talked a little bit about not wanting to go out too much because you don't want to risk bringing anything home to the place you're staying. But any other kind of practical issues around just those basic COVID-19 safety guidelines?
I'm prepared for social distancing and having my PPE or my personal like gear, but I live in a hot spot, so I didn't mention this, but I live in Arizona, so that is a really big hotspot for a lot of COVID-19 cases, and so it's kind of a safety within my walls thing where I live with older people, and I would hate for anything to happen from my action or my peers' actions as a state's mindset behind um, COVID-19. And so there is access to social distancing and wearing a mask and washing my hands, but it's kind of the environment that I live in, and I can't change it as we speak. So kind of a difficult thing.
Right, right. You're stuck in the broader context in, you know, in which you are. There's not much you can do about that. Um, so let me ask you just kind of a big catch-all question. You know, knowing that we have people on this webinar who are involved in providing healthcare to teenagers or to adults, and sometimes mental health care, sometimes physical health care. Do you have any ideas for them if they're trying to provide those services to youth experiencing homelessness? What should they be thinking about? What should they be keeping in mind? And what should they be doing? Kind of what are your suggestions for people on the line today?
I think in order to help or assist youth experiencing homelessness, I think it's smart to help eliminate the barriers behind requirements. And so this might be knowing that homeless youth or unaccompanied homeless youth don't have access to parental, um, I guess, access. So allowing students to have that accessibility without needing their parents' permission or without that insurance requirement, knowing there's a certain situation, or even with COVID, allowing there to be a way for it to be virtual for the first half, whether that's like just talking, discussing the situation. And so I don't have to go out of my way and put my family or myself at risk before I get denied for glasses or mental health care or for dental. And so these kind of firsthand for homeless youth is very important for them to go out of their way.
Yeah, that's a good point. I mean, we hear a lot about how a lot of times you're kind of doing a lot of wild goose chasing because somebody says, go here for this, and you go there and then they say, no, we don't have it. Or you go there and they say, no, you don't qualify. And you spend a lot of time running around, which is really horrible in the best of circumstances because you have to deal with the transportation and you have to deal with kind of the emotional stress behind that. But now the risks are so much higher because it's like real physical safety risks that are in place. So that's a really good point. I want to just kind of give this one last chance, Ash. Is there anything else, maybe a question that I haven't asked you or something that you wanted to say that you didn't get the opportunity to say? Anything else you want to share with everybody who's listening today?
I think I'm more than honored to represent unaccompanied homeless youth, even through Schoolhouse Connections. But I think I'm more honored to know that there's 600 participants who are willing to learn more about people who are in my situation or who have it far more worse or have it completely different, who are having barriers behind getting any access to care or assistance through the COVID times. And so I really appreciate you all for this, and I really appreciate Schoolhouse Connections for being by my side, as they were the first stepping stone for me as an unaccompanied homeless youth. So thank you so much.
Thank you, Ash. I know I speak on behalf of everybody on the webinar that we appreciate you, and we're very grateful to you for your time today and for sharing your experiences. And for Schoolhouse Connection, you know we love you, and we're just so happy that we get to know you and that we get to be part of your life and have you part of our lives. So thank you so much. We're gonna kind of move forward now. It's always hard to move forward when after young people speak, because everything that you have to say is so powerful and so important. But we're gonna try to get through a little bit more information, and then we're gonna wanna hear from some of our participants too and give them the opportunity to chime in. So let me kind of jump us forward here and talk a little bit about the impact of COVID-19. You know, we heard Ash talk about what she's been experiencing personally. You know, some of the other things that we've heard from young people that we work with, and that we've heard from school districts and providers we work with. You know, we know that youth have been forced out of all different kinds of housing. So dorms have closed, and students have been, you know, sometimes given a day or even a couple of days to get out of their dorm and to figure out where to go, which when you don't have a stable home, figuring out where to go is not something you can do in a day, because you're not just going back to your parents' house. You don't have a parent's house to return to. So when your dorm closes, all of a sudden, do you try to find a hotel? Do you try to find a friend to stay with? What do you do? And how do you even put that plan together with almost no notice? We also know that a lot of youth have been forced out of shared housing. You know, Ash talked about not wanting to endanger the people she lives with, and we hear that from a lot of young people. And sometimes, you know, the people providing a place to stay have said, look, we know that you have to go out and work, but we just can't have you going out and coming home because, you know, you're putting us at risk, and so you need to leave your housing. So, you know, a youth has to choose between work and housing sometimes, and that's just not a choice that you can make because you have to work. And same thing, we've heard of young people having to leave campgrounds because, you know, the campground closed, shelters are social distancing, people have to leave shelters. So the instability around housing for youth experiencing homelessness has just been more severe and more extreme than ever over the past few months. We also know that the social isolation is a real problem. You know, I think Ash talked about that in her comments about just not being able to have contact with people as usual. I think every single one of us, we're dealing with this. You know, we're not having the same kind of contact with our peers and even with our family that we're used to. And that really exacerbates the mental health stressors that, you know, we might have been experiencing even before COVID. So that inability for youth to interact, whether with adult mentors or peers, is a really big factor as well. And then just decreased access to services, and Ash talked a lot about this. You know, there are things that you need to do in person or that are just much easier to do in person, and you can't do that any longer. So now you're trying to, you know, deal with phone backlogs and email backlogs to get the very basic things you need, like your health insurance card, or a pair of glasses, or, you know, whatever the issues are that people really need. And we also know that for our youth, very basic access to connectivity sometimes is a daily constant challenge. You know, I was talking to one of our youth the other day who's in college right now, and she was talking about sitting on the ground outside of a McDonald's trying to do her college assignments because that was the only place that she could get on the internet. And believe it or not, that was the quietest place that she had available to work, was outside on the curb outside of the McDonald's. So, you know, just that basic connectivity, as we start to talk about things like telehealth, those are really significant issues. So speaking of telehealth, let's talk a little bit about some of the challenges and opportunities. And we're hoping that you will have some wisdom and some strategies to share with us on this topic. So some of the challenges with telehealth, we've already talked about this, and I think Ash did a really great job explaining issues of consent for unaccompanied minors. You know, when you're under 18, and we assume that you're just going to have a parent sign for things, but many of our youth don't have access to a parent for a lot of different reasons, whether it's that their parent has passed away, or there might be abuse involved, that they just simply can't get information from that parent. Their parent might be dealing with substance abuse. So there's lots and lots of reasons why our unaccompanied homeless youth can't get information from their parents. But if that's a prerequisite for accessing any kind of healthcare, then that is going to completely lock out a lot of our unaccompanied minors. So We do have a resource on our website that provides information about every state's laws on minor consent for routine medical care. The majority of states actually do have legal protections for unaccompanied minors to be able to access health care without a parent, but you can take a look at what is in place in your state if you want to access that document. We already talked about the lack of connectivity and how that creates a barrier. We do have some resources for internet connectivity in our Removing Barriers to Online Enrollment document. So again, you can check that out. Just one caution, we've been starting to get a number of reports from communities where youth and parents were connected to free Wi-Fi or promotion, you know, $1 a month, $2 a month, free for 3 months, those kind of things. But what we've been hearing is that once those promotional periods expire, people have been automatically connected to expensive plans that they can't pay, and they're automatically getting billed for those expensive plans, sometimes being sent to collections because they can't pay. And then that creates an even greater barrier to them ever trying to, you know, be able to get stable housing again, sign a lease, et cetera, now that their credit is tainted with this internet charge. So if you're connecting people to, you know, things that are advertised as free internet, please make sure you're helping people take a look at the fine print and understanding how long that promotion lasts. Is it unlimited data? If it's not, and they go over the data, are they going to get hit with some kind of $100 data overage charge? You know, making sure that we're really understanding what it is exactly that we're connecting youth and families with in terms of those internet promotions. And then privacy is a huge issue. So if you're trying to have, you know, a conversation about physical health or mental health over the phone, and you're in perhaps a 2-bedroom apartment that has 12 people living in it, how are you supposed to have a private conversation about your health? Or if you're in a shelter, or if you're in a motel room, again, with 5 people in that room with you, privacy is a huge issue. So trying to think about, are there particular times of the day when privacy is a little bit easier than others? Can we be flexible with timing? Can we provide headphones for people so at least the sound coming into their room is only in their ears, even if, you know, people can hear what they're saying, they can't hear what's being said to them. So some of those creative ways to deal with the privacy issues. I want to turn it over to Elena now to talk about some of these considerations from her expertise.
Hi, and thank you so much, Patricia. My name is Elena Boyer, and I am with the National Healthcare for the Homeless Council. I'm Director of Research there, and I'm just honored to have worked with the School-Based Health Alliance and to bring Schoolhouse Connection to all of you guys today. And I'm just learning so much as well. And just really, I just for a second need to thank Ash as well. I'm just floored and just really, you know, thank her for her honesty and bravery and sharing that story. And I think I just learned so much from that and really appreciate you being here, Ash. But just briefly, I don't want to take up too much time. When I was thinking about some considerations for how to overcome some of these challenges, and this by no means is comprehensive, and so we'd love to hear from you in the chat about some other innovative ways that might be working for you. At the council, we do focus a lot on adult work, but sometimes that doesn't necessarily translate into some of the challenges that we see that our youth experiencing homelessness might encounter. And so just kind of thinking about that and kind of the challenges that they might be facing, these are some considerations that at least came to my mind after consulting with some expertise in our organization. And they really fall into 2 buckets. And really, I think it's important for health centers or case managers or those who might be managing the health of youth experiencing homelessness to really focus on tailoring those services and really understanding the trauma history of those individuals. And whether it's ACEs, which I apologize for the acronym, but adverse childhood events, or now it's also can be used to talk about adverse community events. And just being acknowledge that abuses happen and might have happened in the past through those types of communications and being aware of that. So if you're trying to conduct health through these teleservices, just being mindful of that and think of maybe some ways to help address that. We know that a lot of bullying might happen through these mechanisms. Other abusive relationships might happen through these mechanisms. So I think being aware of that when you're trying to deliver care is really really poignant and important. I think it's also important to think about empowering your youth with the lived experience to help design those systems. How do you design the safety? How do you design privacy? What do you need to be considering that maybe we as adults might not have thought about and might not have been exposed to? Would be really helpful in tailoring safety around those areas as well. Coming up with a safety plan, alternative plans for delivering that service so that there are secondary privacy places where youth might be receiving that care if they can't do it within their own homes. What is the secondary plan? Where else can they go and conduct those type of private conversations? Or what other mechanisms can you meet with that youth to deliver that care? And some of that can go into making use of what's in your community already, which goes into the second bucket, which is how do you engage your community-based youth organizations that already exist in your area to really get into discussions with them and really help decide and create these ways to overcome some of these challenges. So looking at some of the youth groups that might be your YMCA, YWCA, getting them engaged, kind of how do we ensure that continuity of care through your team-based case management, and really utilizing what's already existing in your community. Using drop-in center space that might already have existing private rooms might be an option as well, and really just making sure the youth might feel comfortable in receiving care in those vicinities as well. So I really encourage you to think about what's already in place, thinking about involving youth with lived experiences in shaping what that delivery of care looks like, so to make sure that we're ensuring that continuity of care throughout their experience. So with that, I just wanted to add that little tidbit there. And we really encourage you, again, this is not a comprehensive list by any means, but it gives us a place to start from and share maybe some other options that you might be doing as well. So I'm going to go ahead and turn it back over to Patricia. We do see the questions in the Q&A box, and hopefully I think the next session might hopefully address some of those as well. So hang on there. Back to you, Patricia. Thank you.
Thanks, Elena. And that was a perfect lead in because we did want to stop for a minute now and go to the chat box and to the questions pane. We'd love to hear what's working in your program or school district or community. Have you found ways to address these challenges? What can you share in terms of your own strategies that are working? And what are you doing differently in telehealth clinical care as it relates to COVID-19 and operations? In any of the work that you do in your program. So I think that we were going to have maybe Ufoma or Miranda or someone read some of the tips that have come in from the chat box, and then we can get to some questions too. Were there any comments coming in from the chat box that anybody wanted to read out?
We're still waiting on more comments to come in, but I do see one here. One person mentioned that they are still trying to figure out how to use a virtual background for those students so that they can better hide their spaces. Sorry, chats are coming in all at once. Okay, another one says, at the floating hospital in New York City, we have moved all behavioral health to a telehealth method, including phone only and video telehealth. Another comment here says that at WIN Youth Services in Sacramento, California, they offer daily drop-in services for 12 to 24-year-olds experiencing homelessness. They also offer support for mental health, behavioral health, art therapy, case management, and they do their best for wraparound services.
Okay, thanks. Well, I think also everyone can see the different comments that are coming in through the chat box. So hopefully people have been reading those as they've been coming in and participating in those. We can move on and just talk a little bit about school reentry and access to services. Again, I think we heard some really good input there from Ash about things that she's been experiencing. Again, it comes back to a lot of the same issues around challenges with connectivity. Youth experiencing homelessness are difficult to identify, contact, and follow, particularly with school buildings closed, even when they're open, but when they're closed, trying to make sure that we're knowing who those students are and providing them with information. So sharing information about McKinney-Vento, staying in contact, providing prepaid phones to youth so that we can stay in touch with them, recognizing that sometimes cell phones get cut off and then we might lose contact with someone, maybe forever. So providing them with a prepaid technology is a great way to stay in touch. And we do have a tip sheet on our website with more strategies for keeping in touch. When we talk about distance learning, again, we get back to those barriers to connectivity that we already talked about. So keeping in touch is really important. If there are in-person classes and services available that are safe, prioritizing our youth experiencing homelessness so they at least have the option to access those in-person services, that can make a really very fundamental difference in terms of their ability to participate. Again, we talked about the social isolation and how that can trigger trauma. So we've been encouraging schools and healthcare providers to screen for trauma just as a matter of course. There's lots of trauma screenings out there that I'm sure you're all very familiar with. Again, we have some on our website as well in our reopening and reentry document where you can take a look. And try to connect youth to mental health support in person if that's possible, or telehealth if that's better. It's really kind of case by case, I think, what's going to be best and most accessible to each individual youth based on their particular circumstances and the realities that they're dealing with in this COVID-19 situation. And then making sure that we can provide youth with some of the most basic safety precautions. So like Ash mentioned that she has had access to hygiene supplies and masks, and that hasn't been an issue, but we know some of our youth don't have access to that. And so if they want to participate in something in person, it's really important that they be provided those supports so that they can do that. Let me turn it over to Jillian now to talk a little bit about some of what's happening on our college campuses.
Thanks, Patricia. So many of the challenges that students in high school face, colleges do as well. And so I just wanted to highlight a few of them. Identification is huge. And so, we want to be able to work with our partners in the high school to inform colleges of incoming students experiencing homelessness coming to that college. Some colleges might actually even have a homeless higher ed liaison role to help identify these students. We're also seeing a lot of colleges create surveys or questionnaires that are asking students about their housing status even before they come onto campus. Faculty members are also another great resource as well, especially if campuses are going remote, because faculty might be the only higher ed person that the student is interacting with. And I'm going to add a link in the chat box portion about a video that we just did that talks about more identification and outreach practices. But again, we already have talked about, the challenges with distance learning. We know some colleges are actually offering laptop and hotspot loans. I know the University of California, Berkeley is doing so. They're actually mailing these items directly to students, which is really great. Again, tapping into that faculty member to do a basic needs assessment survey for students, asking them what they need to be successful in their class. So something as small as, flexible class schedules, or being able to record the sessions and have a transcript in case a student isn't able to join in at that exact time. Another really helpful thing too with faculty is that some faculty members might be requiring a screen. And just like Patricia said, students experiencing homelessness might not have the privacy to do so because they might be in a place where there are people running around. It might not be quiet. So just small things for folks to consider. Again, we know about self-isolation and triggered trauma, so proactively conducting outreach to students is definitely important. We know that many campuses are offering teletherapy, which is great, but we are also really encouraging and advocating for online group therapy or peer mentorship or cohort models, something to build that sense of community, especially if your campus is going completely virtual. And again, similar to what Patricia has already said, but we want to make sure that students are meeting their basic needs. I'm not going to go through all these bullets, but we want to make sure that our students are being prioritized for on-campus housing if there is campus housing, or at least to make exceptions for these students to remain on campus housing if the campus is closed. Also, campuses might be requiring students to take a COVID-19 test prior to coming onto campus, which is fine, but they should not be making the student purchase these. This is something that we were actually talking about in our staff meeting today. And so if colleges can actually provide students with the COVID-19 test, that would greatly remove at least one barrier. Colleges are also sending health kits, so they're providing the reusable masks, the hand sanitizers, thermometer, all of those things. And while that's great that colleges are being proactive, it's super important that they are asking the students where to send these items, because we know that the students experiencing homelessness, they might not be residing at the address that's currently listed on record on the campus. So do proactive outreach with them, confirm their point of their contact information. And then lastly, the FAFSA has already been an issue even prior to COVID, but it's continuing to be so, even more so right now. And we really want to make sure that financial aid administrators are specifically trained on unaccompanied homeless youth determinations, because this process can be really tricky. You know, we heard from Ash about the documentation and everything. So we really want to be mindful that we're not adding any more additional barriers for these youth to access their financial aid. And so we provided some tips on the link that's listed there, but one really great one is just providing space. So office hours for financial aid, either in person or virtual, specifically for students experiencing homelessness. And so again, I know we kind of flew through those slides, and keep adding examples of strategies of what's working in your program. And we would love to highlight those, so please keep adding them into the chat portion. But we really just want to know what's working, what's not working. If you are reopening, how are you reopening? And if you are working with your school on any sort of reentry plan. So continue to keep adding those questions in, and or those strategies in, and we probably have time for a question or two. So I will go ahead and read a question. Let me find one. Let's see. I feel like we touched on a few of them about the distance learning with access to Wi-Fi, but we have a question about if students are undocumented, how can they get help for healthcare? And I'll turn it over to any of our panelists to take that on.
Thank you. Now is the time to enter your questions into the chat box in your Zoom control window. While you are entering your questions, we will also be launching our evaluation poll questions. Please take the next few moments to enter your questions and complete our evaluation poll. Okay, so I see some questions coming in. One question we have here is, how do we assist our homeless students during distance learning? Most, if not all, do not have access to Wi-Fi. We are concerned that they are missing out on educational opportunities.
Well, many schools are providing that, that internet connectivity to students. So they're providing mobile hotspots. They're providing, data plans even for cell phones and for handheld devices for people who don't have computers. A lot of schools are providing Chromebooks with mobile hotspots right in the Chromebook. So that connectivity is being provided to the students by the schools. You know, there are places that just don't even have cell service at all. So even a mobile hotspot's not going to help. And so in those extreme cases, we've heard of schools that are providing paper learning packets, either delivering them to the students or mailing them to the students.
We have a question about undocumented students. If the housing is unstable and inadequate, then do they qualify under the McKinney-Vento definition and would be considered homeless?
Whether a student's documented or not really doesn't figure into the question of whether they're McKinney-Vento eligible. It's just based on the housing. So if the housing is not fixed, regular, and adequate, then the students would qualify under McKinney-Vento.
And we have time for 2 more questions. Okay, so there's another question. Schools do not have up-to-date records for their students. Do you have any strategies for locating students that are working?
Jillian might have some strategies specifically for the higher education age group, but we do have a document on our website called Keeping in Touch that has a whole list of strategies for keeping in touch with students and families experiencing homelessness. So I would point people to that document for a list of strategies.
And for the higher ed portion, I'm not entirely sure of any current strategies aside from reaching out to students directly. I do know that right now there are so many changes that are happening on campuses, going in person to remote to hybrid to everything, and it's kind of information overload, and so students might not be reading their emails or reading them as thoroughly. And so we're actually seeing some colleges using texting applications like Chatbox to reach out to students because they're a little bit more responsive when they get a text rather than a really lengthy email. So that might be one way to get contact information.
Okay, and we'll take one more. This question is about the slide with communicating between high schools and colleges. Is there a FERPA and or HIPAA issue with sharing information without explicit permission from student or parent?
That really depends on the kind of information that's being released and the purpose for the release. So it's kind of a complicated question. So rather than try to answer it now, I would refer people again to our website. We have a couple of documents specifically on FERPA that go into a pretty good amount of detail around the legal requirements and protections of FERPA when sharing information.
I will pass this next slide over to Jillian.
Great, thank you so much. And so we are having our scholarship program. The application is now live. That is where the program that Ash is a part of. And so please feel free to check on that website to see more about the eligibility and the deadline. But it is truly such an amazing program. And as you heard from Ash herself, it's just really amazing students that are a part of it. And then next, I think the last slide is just our contact information. So feel free to reach out to Patricia or myself with any other tips, strategies, or questions. And we just thank you so much for being a part of this presentation today.
Thank you, Patricia, Ashley, and Jillian. We want to thank all of our attendees for joining us for today's webinar.